Hello, good afternoon. My name is Yvonne Agbu, and welcome to the Student Health Show. I'm here today with.
Maria Antonietta Sapong.
It's very lovely to have you again,
Thank
Antoinette.
you.
Yes, please. Today we're going to be talking about the dangers of drug abuse. So, drug abuse is a very serious thing, and it has a lot of devastating consequences. It can lead to addictions. It can lead to family problems, societal issues, even like arrests and things. Death, not to talk about the
Yes.
medical complications.
Mhm.
So today we're going to just dive into that a little.
Yeah.
Yes, please.
How are you today?
I'm fine, thank you very
Fine,
much.
good.
Yes, please.
Okay.
So what do you think that the major drug of abuse is in students?
That's a tough question because I feel like are we talking about students that don't indulge in alcohol and other like
Recreational
recreational
drugs.
drugs and the students that just use so okay for the students that don't indulge in recreational drugs, I would say probably painkillers.
Para.
Yeah, para.
Yeah.
I think yes.
And probably like ibuprofen.
Yes, Tylenol. Someone will come, oh please, I'm looking for Tylenol. Yes, those kind of things.
Yeah.
Yes. And I feel like for people who use recreational drugs, I'll say alcohol, between alcohol and weed.
Yeah.
Do you have a medical term for weed?
Marijuana.
Yes.
Okay,
Yes,
wonderful.
yes,
So
yeah.
I completely agree with that, to be quite honest. And I think like with the whole substance abuse, like nobody wakes up in the morning and thinks like, oh, today I'm going to get addicted to drugs.
No.
It starts very,
Very
slowly.
small, very
like your friend is taking a sip of alcohol and they're like, oh, do you want to try? And like you take a sip and then suddenly you're taking too many sips.
People,
Yeah, it's always like a
Yeah.
very slippery slope with the whole thing.
guys, peer pressure is real.
It's real. It's really
so
real. Like
yes.
if you do a census, like you ask how many people, like college students and things. So like how did you start drinking and things like that?
Yeah.
It's always, oh, my friend introduced me,
Yes.
or I went to a party with this person, or
I
like,
just should, yeah, those kind of
I just
things.
thought I should try.
Yes,
You
yes.
see, don't try things you can't stop.
Don't
Try things you can't
Yes.
stop. Yeah. So I mean, yeah. So I agree with the alcohol and the weed. And how do you think that affects like their life as they go forward, as they get like more attached to the substances?
I feel like removing yourself from addiction is so difficult.
Oh, almost
It's,
impossible.
it's almost impossible because
But we can do it.
yes, we can. But because I think you've grown an attachment to the thing, you find solace in it. So it's just so difficult
To stop.
to stop. Very
I mean,
difficult.
especially for the things that like take pain away and like give this like euphoria,
Yes, yeah,
right?
I think it's
The pain meds, like that's why it's quite easy to get addicted to. I mean, who
yes.
doesn't want their pain
Everybody
to go
wants
away? So yeah, I mean that's very easy to get addicted to. And then like if you start noticing things like you have to take more of that substance. Like
Then
maybe
you
you used to
know.
take like one glass of alcohol and then you would
Get
be
it.
feeling like high, and now you have to take like three glasses.
Oh, no. Then you should know
That's
this.
you're already so yeah. So I mean, if you're noticing that you're taking more of the substance, like you used to take one glass, but now you have to take three glasses, then already you're on your way like to becoming addicted.
Yeah.
That's like one of the signs,
It's
right?
true.
And like if you wake up in the morning, you have to
you have to take
you just
it.
have to, or like if you decide, I won't take any today, then like suddenly you're having like your hands are shaking and like you are very agitated and very aggressive. I mean, all those come together. Or like let's say your friend invites you somewhere, but like you would rather be in your room, like taking the
Yes.
substance. I mean, you're starting to
it.
withdraw as well.
Yeah, I
So
think those are all signs.
those are all signs. So I mean, for instance, like it gets so bad actually because like you could go to the hospital and tell you like, oh, you have like a liver disease,
Yeah.
a problem with your liver, and you still drink like the alcohol.
Yeah.
That's why knowing that like
You have
the
that
alcohol is
issue,
causing the issue, right? So I mean, it really gets to like very severe things, and I mean, it's not the person's fault actually, but Addiction is just it's a whole ball game on its own. But I mean, you can always seek help, to be quite honest.
Yeah, that's true.
Don't think you can do it by yourself. You can't do it by yourself. You have to. Your loved ones are there to help.
Don't try and be too strong. Like, let other people.
Don't be too strong. Don't be too strong. My goodness. Anyways, so yeah, I mean, apart from addiction and like, what else do you think it really contributes to?
So, see, when I came to university first, like I had like people around me used to drink alcohol. But I was like, oh, I'll never drink alcohol because I don't like the smell of malt and things.
I can't imagine wanting to drink something so bitter.
And I think I went to try one like cocktail, and I was like, this is nice. Like it was so nice. But you see, that thing is I think the cocktails are very dangerous because you take one.
You think it's not like strong because it's sweet.
Then
no. Guys. I mean, personally, I don't drink anymore because I'm like, please, I need to be healthy living. It's actually really bad for your organs, to be quite honest.
It's not, but I think once you can control, but that's the thing, you never know if you can control it or not. Exactly. You never know if you know you can't stop. I don't think you should start. Yes. And I think there's this saying that someone told me, and the person was like, someone would drink alcohol, maybe 2 bottles of alcohol, and it'll be perfectly fine. You go and try one day and that actually really just reminded me of something. So I just finished my psychiatry rotation, right? And we were like treating like patients that had like mania and depression, all those things. And fun fact, I didn't know this before the rotation, but it's like you could have a family history and you would be fine. Like it's not like you have mania or anything, but then you try a substance and it kind of triggers it. Yeah, I've heard that before. That someone tried alcohol or smoked cigarettes and
then suddenly like you're in the hospital.
Yes.
Yeah, in the hospital, people are like, oh, why did he go? And you know, they call it crazy.
Yes.
And you're like, oh, why did he go crazy? But it's like, how do you know that you have a family history before you take the substance? So it can really trigger things. Even the substance on its own can cause, we call it psychosis, right? Because we don't use the term crazy in medicine. So I mean, even the substance can trigger it. So honestly, we just have to be like very careful about things that we try. Curiosity, what did they say? Kills the cat. So I mean, being too curious is not an amazing thing.
Guys, for the people who don't know, schizo is schizophrenia. Sorry, I use the short form.
Yeah, I mean, it's just, I mean, part of the mental health conditions. It alters like how you think your perception. So I mean, that's a lot of the mental health conditions, altered like sense of perceiving the world. So yeah, I mean, sigh.
And as students, like I know sometimes we are learning, you are stressed, and you think, oh, let's go out and have fun. Then you want to find like some, some substance in alcohol and things. I feel like that's really when like the weed and all those things come in, especially for like people who are doing like high like tension courses. But I mean, I heard weed gives the that you have the best of your life. And I heard at the beginning. I heard because like I don't know. It's not something I feel like I want to try. Even though I have like people around me, but it looks interesting, but no. I don't think so. I feel just because I mean, fresh off psychiatry, I've seen a lot. I've seen things. I don't want to be part of the things. You never know what is in your family or what is going to really cause that trigger. So. And it's like I feel like I have this thing where my mom is like always using me to do prayers. And it's like if somebody goes to do something bad, they may escape. Like nobody will even know. But my own is never the same. I try something bad and like suddenly my mom knows, or suddenly like it's on like social media. It's like the things I do, I'm always exposed. So I don't even attempt. I promise you, I don't even attempt to do anything. So I mean, apart from that, like the health consequences of like drugs, and like because we mentioned at the beginning, like drug abuse is not just like the alcohol and the weed, right? It's also like the pain medications and things. So I mean, the damage to the liver and the kidney is not a joke.
And in Ghana, we do not do liver transplants.
No, we don't. Yeah.
We don't do liver transplants.
Healthcare is not.
We don't even do
not
kidney
a joke.
transplants. I
Yes.
mean, we have what dialysis for kidney, but like even that's quite expensive.
Yeah,
So
so an average person
can't afford it. No, you can't afford it. Healthcare is too
Yeah.
expensive to be afforded.
But do you think that there are a lot of like should I say platforms that are talking about all of these? Because you see, when the price of the kidney dialysis came out, now people were scared.
People were talking about it.
Like people try. I know some people try to like, hey, I have to go and check everything to make sure, because right now
Everything is
healthcare is
fine.
expensive. Do you think there are enough platforms talking about these things to let everybody understand the cost involved, like and explain it in layman's terms, like exactly what is going on or what you are doing in the long run?
Yeah, I mean, I have seen some platforms like that, and like they do talk about like the consequences and like what it is that you're doing that is actually leading to all these things. But I feel like people, maybe I don't know if they don't care or they don't fully understand, even though it's being explained to them. Because like they can tell you, oh, alcohol damage your liver, but it's like my liver.
But I understand. I mean, as a teenager, we are in school.
You're
Like, I'm so young.
I'm young, I'm free.
I'm
like,
free,
what are you
yes.
talking about?
What is coming to university and not doing all of these things?
Yeah, like, oh, like
Yeah.
it sounds like, oh, it's something so far away, like, oh, my liver will be damaged. Like, okay, maybe that can happen in the
Yeah.
future, kind of
But
thing.
now
But right
You're
now,
not thinking about that.
yeah. So I mean,
It's crazy.
it is. It really is.
I think one day they need to make people come past to the hospital and see exactly what we are seeing, because sometimes
Do you know?
they are so preventable. Like
They are so preventable.
lots of
Like the
cases,
saddest part for me is when like patients come in and you tell them like, oh, you have this condition, you have this, and they go, oh no, I don't. And you're like, oh, you have to come like for review for treatments, and they just disappear, and
They
then
will
you
not
see
come
them
back.
like 6 months
when
later,
the case has just
and it's
reached,
gone.
you can't.
And then they tell you that Kolebu
Killed
is
them.
where you came to die.
that misconception is bad.
It's really
so
bad. I mean, we're a
ugly.
tertiary institution, so we're literally the last stop.
Stop that
It's not
everybody
like we're
comes.
killing you. We're really actually treating.
Exactly.
And they come and they're like, oh, Kolebu is the place you come to die, this, that. But it's like you were given a diagnosis and you didn't
come.
accept it. You can't come at last minute, and we don't do magic over here, you
That's
see.
true.
So I mean, when I did my pediatrics rotation, there was a boy that came with, was it like a liver disease or something? And he had like ascites. He was like swollen, just water everywhere. And his parents, apparently, when they first came and they told them diagnosis, didn't accept it and went to like a church camp. And so by the time they came back, he was like, it was gone. Like there was nothing we could do.
About it.
And so when you say, oh, Kolebu is where you come to die,
You
like
cannot, yes.
that was really sad. I cried for that one. Like
Oh,
it was
that's-
very sad. I can't do pedics.
can't do
Pedics is not my
pedics.
calling. Pedics is not my calling. I don't like seeing sick children. I like the healthy ones that are running about.
I
Yeah.
understand. Yeah.
Anyways.
I remember I just finished psychiatry before I started my new rotation, and I remember went to where the children are, and they look very, I don't want to say, but they don't look like children. Some are adults, but they look like children. Like they don't look like the normal or average person should look like. And the man is like, this is a result of drinking alcohol, taking substances during your
During
pregnancy,
pregnancy,
trying
that
to
thing is
abort,
really
and it didn't
bad.
work. Like, it was
I
just
see
so
that actually
sad.
falls under like the drug abuse thing. Because I mean, if you are addicted to alcohol, for instance, and you get pregnant, the chances that you will stop during your pregnancy are quite low. And we don't really know the amount of alcohol that you can drink during pregnancy that is
You know the
safe.
funny thing, I saw somewhere
Somebody
on
said a
Instagram,
glass.
a glass of wine.
No.
I was like, really?
It's not true. It's not true. So it's like science hasn't really proved like
that
the
even.
amount. So you could take one glass and something goes wrong,
Yeah.
right? And like it's just best to not take
Take it.
any at all and not risk it. I mean, 9 months will come and go like right now.
What at all are you looking for that you are?
Like that you have to
Yeah.
drink the alcohol during pregnancy. But I mean, if you are addicted, it's not something that you can say, oh, you won't take. And then the children come out and they have like
So much.
facial and all these things
They
like,
become a burden on you, and now you are.
and it's
giving
terrible
them
because
up
this is a
and
child that
things.
could have done
Lived a
wonderful
very
things.
normal
And
life. True.
yeah.
It's crazy.
Anyways, so yeah, you guys, don't do drugs. Stay in school.
Please, don't overdo it. Yes.
Eat your vegetables. Yes, please. So, Antoinette, it was really nice having you here again today.
I had fun today.
I had fun as well. Is there anything else you would like to add for us? No? Okay. Yeah. So, thank you very much for joining today's episode. We will see you next time.
Bye.